Hi and welcome. I'm trying to learn medicine, today acromegaly, and after you've done it we're going to do wrist training, and if you participate in wrist training then it's at your own risk. This is part 2 and we're talking about internal anatomy a bit, about disorder or disease, and this is no medical advice, we're just really reading and learning about it. Acromegaly. That is a disease in which the skin thickens and the hands, feet and face, particularly the lower jaw, enlarge. Okay. The skin thickens and hands and feet and face are thickening, and in particular does if the lower jaw enlarging. What is the result? It is the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. And what happens because the pituitary gland, which is something in the brain, is producing too much growth hormone. A benign, non-cancerous tumor of the gland causes the excess production. It is a benign, so not a cancer. A tumor of the gland, it is not a tumor which is not a cancerous one. A non-cancerous tumor is causing that the pituitary gland produces too much growth hormone. Treatment consists of destroying the tumor by radiotherapy or by removal of the gland. It can be treated with radiotherapy or removing of the gland. Acromegaly occurs after the age at which normal growth stops. Excessive production of growth hormone in children produces a different condition, gigantism. Acromegaly occurs after the person has left normal growing. If the pituitary gland is doing excessive growth hormone, which is called expression, releasing. Well, it's gigantism. Do we see what it is? Because if the person gets too big, I think, too high. Let's try, but let's take F. G. Hier is nog gigantism. Couldn't find it. Gigantism. Okay, so acromegaly. Acromegaly is a disease. Acromegaly is a disease by which the skin thickens and also the hand and feet and face are getting too large, and especially thus that the lower jaw. That is caused because there is a non-cancerous tumor at the pituitary gland, which is into the brain and which is releasing growth hormone. Normally, this acromegaly happens after childhood. How is this expressed here? Acromegaly occurs after the age at which normal growth stops. Now this acromegaly what do we just say? Well, the same words. Acromegaly occurs after the normal growing has stopped. If it happens during childhood, this excessive production of a growth hormone from the pituitary gland, then it gives gigantism. But it's according to Keith Hodgkin's family medical by page 62. I have a second camera, which I'm going to start now. Acromegaly is a disease by which the hand, feet and skin are getting enlarged, and especially the lower jaw. And it is caused through the pituitary gland, which, because of a non-cancerous tumor, is releasing excessive growth hormone. That occurs after the normal growing has happened. If it happens already during childhood, this excessive production of growth hormone, then it gives gigantism. And that is according to Keith Hodgkin's family medical advisor, page 62, but this is no medical advice. Okay, we have that. I'm going to stop the camera and start again. course, we came over two interesting things. I don't know if you're taking this book now, maybe with these things a bit literally or something, but let's take it. Here, circulation problems in the eye. There was written, the small hemorrhages which can occur with diabetes or high blood pressure are part of a general strain on the circulation which these conditions can cause. Blood vessel blockages are usually caused by small clots which may form in arteries affected by atheroma, or in veins crossed by small hardened arteries. If I understand this text correctly, that means that there's just a hardened artery lying on a normal vein, and that blocks it. Can there no hemorrhages happening in veins? We're going to take them by word and take it like that. Exhibitionate what is here said, so that it becomes clear that we are wrong or right. So how do you want to say it? I can say it. Blood vessel blockage can occur through hardened arteries lying on top of them, according to, we're going to say it like that. Blood vessel blockage can happen through hardened arteries lying on top of them, according to Keith Hodgkin's Family Medical Advisor, where it says, blood vessel blockages are usually caused by small clots which may form in arteries affected by atheroma, or in veins crossed by small hardened arteries. But this is no medical advice. I'm setting the camera again. And not the other thing, which is more clear express. But there would be an important thing, and I don't know if you find it anywhere else. We are pretty close to a source. It was just here. It was the rib syndrome, cervical rib syndrome. Yeah. Cervical rib syndrome, one rib too much. Now there was written here. Pain in the arm may also result from a nerve getting trapped by a neck muscle. You're going to read it. Let's maybe start with. Let's start with the thing. If you notice such a symptoms, it's clear that we're taking it out of context. And the question is, a muscle can a neck muscle can trap a nerve and cause pain. A muscle can trap a nerve and cause pain, according to Keith Hodgkin's Family Medical Advisor, where it says under cervical rib syndrome, if you notice such symptoms, report them to your doctor. It's spoken of cervical rib syndrome symptoms. He may recommend x-rays to find out whether a cervical rib is present, though in most cases the symptoms will have resulted from some other cause, such as cervical spondylitis or carpal tunnel syndrome. Pains in the arm may also result from a nerve getting trapped by a neck muscle. But this is no medical advice. Okay, do we have that? I'm going to stop the camera. And that was the acromegaly. Alright, I'm going to try. If you were here for medicine, you can go directly to the next part of medicine. We will do now the wrist training. If you stay and participate in the wrist training, then it's very dear on this good step stance. Arms next to us, hands on the fists. We're going down the fists spotlight. And again up. And down. And now again fists into the inside. Into the outside. And flat hands and to the inside. Then magician. Now we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as fast as we can go with a little bit of effort, make the exercise, flat hands and open the pancake flipper. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. And next exercise, the T-Rex in the morning. Flat hands out and down. And the next exercise, we're going to cast like it, fists into the inside. Outside. And the other way, down. And now the trap into the fever. Fists down and press a bit against it. Pull the wheel outside. Lift the top. And the bottom. Out on the other side, fist down, press a bit against it. Pull on the outside. Press one time. And one more. And we're going on with the T-Rex in the chin. Press with moderate force on the tennis ball, or do it without one, just make a strong fist. Release and press again. Release and press again. And switch. And press. Release and press. Now cautious big bang. Place the fingertips of one hand on top of the fingernails of the other hand. Press a bit and open slowly and close slowly. And another time. And to the other side, so switching. And now the arms up. Bring the fists into flexion, strong fists, and bring them down. Go to the same stance. And again up. Now turn it around. Keep this flexion position. Again down and up. And turn again around. Stay in flexion. Down. And up you can be a bit slow. And last time. Turn it around. Down. Up. And then down. Up. Next exercise. The feel this into Cynthia's doing that. Open the wrists and close. And open. And now you can take a break if you want to. You can take a break all the time. We have a lot of exercises. Well, down with the hands and with the fingers. Again, up, strong fists. Before testing the water temperature. Down, flat fingers. So skip this exercise. These are a lot of exercises. And again down. And up. One last time. And now the bicycle bridge. Flat hands and bend them at the knuckles. And up. Again bending. Open, last time bending, and open. Another claw, flat hands and the claws, and open, claws, open, and last time claws. Open. Next exercise. Arms in, strong fists into flexion, and the outside extension flat fingers. You can skip this exercise again if you want to take a break. We just want to stand, not exhaust. And again out, extension flat fingers. In, strong fists flexion. Out, extension flat fingers. And in. And out. And also that. And now the ice axe. Flat hand, bend it to knuckles and press on all 4 fingers. And with the other hand. And with all 4 fingers, press it. And we've made it to the last exercise with unfolding rocket boosters. Tall up and long arms, strong fists, and these fists into flexion. And out extension flat fingers. Inside strong fist flexion. Outside extension flat fingers. Inside against strong fist flexion. Outside extension flat fingers. And flexion last round. And extension flat fingers. Now, with the closing exercise, we go with moderate pressure over the middle part of the lower arm to relax the extensor digitorum muscle. But last time, no one. And on the other side. And that was the wrist training. I thank you very much. And